Welcome to VRpatients, the exciting platform where you can hone your critical thinking skills treating real-life patients without real-life consequences. To run the VRpatients platform, you need to be using a 64-bit version of Google Chrome. We are not compatible with phones or tablets. Do not create an account on the web page. Wait to receive an email inviting you to VRpatients. Click on the Accept Invite link. This will take you to the End User License Agreement. Read or scroll to the bottom of the agreement. Select I agree with this license agreement. You will be taken to a login screen. Fill in your first and last name and set a password. Passwords should be a minimum of 8 characters and contain uppercase letters, lowercase letters, and numbers. When you select Create Account, you will be taken to a homepage, app.vrpatients.com. Scenarios will become available on your page when your instructors assign them to your account. When you are alerted to an assigned scenario, log in to VRpatients and the scenario will be available. You will see important information about the assignment. When ready, click the Run button, and the scenario will begin the loading process. During the loading process, you will be presented with information about the scenario. When the loading is completed, the Start button will appear. Select the Start button, and you will be transferred to the scene where you can begin assessing, monitoring, and treating the patient. Use the Settings button to change the language that the system will use during the simulation. This will not change the dialogue language. You can also adjust volumes and select closed captioning for the simulation. Use the View widget in the corner to move around the patient or examine the patient from a different location. Use the Assess tab to begin assessing the patient. The Patient Info tab will provide you details about the patient. The Resources tab will hold select images that have been loaded in the simulation. Pictures or EKG images can be found here. Click the image to get a closer look at the image. Clicking on the PPE tab will allow you to select from available personal protective equipment to use during the simulation. Dialogue allows you to communicate with the patient by asking questions or by giving commands.
Great. Liam McNeil, May 31, 1964.
You will also find communication options that are available with resources that are not physically depicted in the simulation.
That is good to hear.
The Diagnostic Tools tab provides access to the stethoscope, pen light, thermometer, and glucometer. When you select the stethoscope, the cursor becomes the diaphragm. Move it to an area of the chest wall to hear the lung sounds and heart tones. Reposition yourself behind the patient for the posterior sounds. To examine the pupils, select pen light and shine it on the pupils to see their reaction. When selecting the thermometer or glucometer, the result will be displayed on the monitor. To reassess either, select the appropriate refresh icon. The Assessments tabs allows you to gain information by performing a physical assessment, palpating a pulse or the spine, and exposing the patient. Selecting the physical assessment allows you to examine different body parts and see information the scenario author has provided. Select Palpate Pulse to assess the pulse strength. The cursor becomes a gloved hand. As you move the cursor over pulse points, a strength of pulse scale will be visible. When you select Palpate Spine, The cursor changes to a gloved hand. You can roll unconscious patients to assess the spine. For conscious patients, you are taken to a posterior view, allowing you to palpate the spine. Clothing can be removed for visual inspection via the Expose Patient tab. Items of clothing can be removed and replaced. The Monitor tab allows you to gather vital sign information and access monitor and defibrillator functions. Use the Vital Signs tab to monitor the patient's EKG. You can connect the patient to the monitor via the ECG tab. To obtain a 12 lead, select ECG 12 lead. You can monitor the SpO2 and the end tidal. When the SpO2 is attached, you can choose to display the heart rate. You can select to take the blood pressure and set an interval for subsequent blood pressure assessments. Defibrillation and pacing are only available when pads are placed. To defibrillate, choose Monitor, Defib, select Energy Setting, Charge. When the charge is complete, you can clear the patient and deliver the shock. To pace the patient's rhythm, select Pacing, choose the current and rate setting. Then administer. Once started, you can change the settings or stop pacing the patient's rhythm. The Treat tab provides access to a variety of treatments and interventions. Oxygen is found under the Treat tab. Select a delivery device, the flow rate, then administer. To administer a medication, select Treat, Medications. Select the medication, route, the unit type, the dose, administer. To initiate an IV, select IV access under the Treat tab. Select the type, the number of ports, the side of the body, needle gauge. If the saline lock option has been turned on, you can select on or off, then select administer. Fluid options are available via the Infusions Fluids tab. To initiate a fluid or infusion, select Treat, then Infusions Fluids tab. Select the medication or fluid, the volume of the bag, the location you are connecting the bag to, the control you are using, drop set or pump. When using the drop set, set drip rate, choose the drip set from those that are available, enter the rate, and then set and administer. When using the IV pump, set rate and enter values for two of the options: volume to be infused, rate of infusion, and time to be administered. When two options are completed, the platform will calculate the third. Select Administer to initiate the infusion. The Reassess button provides options to monitor or change the infusions that have been started on the patient. To monitor the progress, select an infusion. This shows the remaining time and amount to be infused. It also allows you to make changes to the infusion. There is a calculator under the Treat tab. Functionality is straightforward. It does not do anything in the platform other than calculate math for you. Medical interventions, compressions, vagal maneuver, and nasal swab are available under the Treat tab. To perform chest compressions, select Treat, Medical Interventions, Compressions, enter the rate, then administer. To perform a vagal maneuver, select Treat, Medical Interventions, Vagal Maneuver. To perform a nasal swab, select Treat, Medical Interventions, Nasal Swab. If the patient is on a hospital bed, you can choose to raise or lower the bed rail. Select Treat, Medical Interventions, Raise or lower the bed rail. For trauma treatments, select Treat, Interventions, Type of treatment, Location, Administer. If you choose to re-examine an injury, you can remove the treatment by using the Reassess. Select the location, the treatment if multiples were applied, then remove intervention. You can transfer the patient to a new scene and continue treatment. When the case ends, you will receive a debriefing assessment based on the options the scenario author selected. Thank you for watching this VRpatients video.